Gut health. This might not be one of the most exciting topics that I've talked about, but it is one of the most important. Because if you think about it, the machinery that actually processes the food that you eat and that turns it into you and the energy that you use to live every day actually ends up being pretty important. So let's start to break into it a little bit here. Gut health is linked to physical health, mental health, dementia, cancer, so taking it seriously really matters. And today I'm going to give you a comprehensive overview of gut health. What is the gut? What is the importance of the microbiome? What effects do good gut health habits have? What steps can you take to improve your gut health? And we're going to also go through some common gut health diseases as well today. I'm going to answer all these questions and more in today's episode of Health Reframed. My name is Jack Snyder. I am an EMT, and I've worked in healthcare for around 4 years now. I applied to med school this year. I've also taken the MCAT, and will start med school next year. That's the plan, at least. So today we're diving into gut health. Let's get right into it, I suppose. Let's start it with what is the gut. Let's break down the GI system for everyone. So what most people call the gut is actually the gastrointestinal or GI system. This system in the body is responsible for breaking down the food and absorbing it and processing it so that it can be used for energy, pulling nutrients out of it. Think fats or carbohydrates or proteins. Your body needs all of these things on a day-to-day basis. It also absorbs water, and it's how many drugs get into your body. From end to end, the GI system is pretty big. It's around 30 feet long if you were to stretch from your mouth to where the sun don't shine, so to speak. However, all of the processes that go on inside of your GI system are very complicated, and likewise the system is rather complicated as a whole. So let's break down piece by piece, starting with the mouth. So the mouth, as many of you are certainly aware of, is where digestion and food consumption starts. You break down the food with your teeth, chomp, chomp, chomp. This helps break it down into smaller pieces so that it can actually go down your throat, down your esophagus, and reach your stomach. But that's not all that happens in your mouth. Digestion actually begins in your mouth as well. So pause here. What is digestion? So simply put, digestion is breaking down the chemicals in the food into usable forms. Oftentimes, the foods that we eat contain plenty of chemicals and nutrients that are very beneficial for us, things that we need, but they're not in forms that we can use yet. So we actually have to break them down chemically. And this begins in the mouth with some enzymes. And so you chew, start the process of breaking down food, go down the esophagus, and now we are in your stomach. So the stomach has a few functions. First of all, it continues to break down foods with enzymes, acid, and mechanical movement. So from here on out, mechanical movement is going to be really important. Your food has to actually move through your GI system, so you can consciously swallow, but you can't consciously move your stomach. We'll get a little bit more into that later. But the movement of your stomach actually squeezing the food and breaking it down is important, as well as the stomach acid, the hydrochloric acid that your stomach produces, and again, enzymes. Enzymes are going to be chemicals that help break down food and break bonds, chemical bonds, that sort of thing. And you have a couple of these in your stomach. You have enzymes that break down fats and proteins specifically, but not carbohydrates. And the acid is also really important here. It's very caustic. It has a very low pH, so if you were to touch it even, it would be rather dangerous. And it serves to kill any pathogens that you may have eaten. There's a lot of stuff on our food that just gets on there. There's a lot in the air and a lot around us in terms of pathogens that might be dangerous. But thankfully for us, the stomach acid gets rid of those. And the reason that your stomach acid doesn't eat you alive is because you have a relatively thick layer of mucus lining the inside of your stomach, really at all times, that is secreted and protects your stomach. And from here, things start to get a little bit more interesting. At this point, the food is a goop that we call chyme, and now it's going to be headed for the small intestine. So the small intestine is broken up into a couple parts, but really the only one that you guys need to know about today is called the duodenum, because it plays a pretty important role. So the duodenum is the first part of the small intestine, and it's connected right to the stomach. And this is where important digestive juices are secreted. So your pancreas and your liver and your gallbladder all secrete digestive juices. Or I should say your liver produces bile, which is stored in the gallbladder, but they're very closely connected. And these juices enter into your GI system via the duodenum. And these digestive juices do a couple of things. They break down proteins and fats and carbohydrates and really all kinds of things. But from here, now that you have the chyme mixed with these digestive juices, I know it sounds very, very pleasant, right? The small intestine starts to actually absorb some of these nutrients. So at this point, we've broken down the food to a sufficient point where your body can actually start to absorb it into the bloodstream. And this is because we've broken the food down into the smallest building blocks, so amino acids, simple carbs, etc. And once they're this small, they can start to absorb into the blood. But how do these chemicals get into the blood from the tube that is your GI tract? So this happens because the inside of your small intestine, which is basically a very, very long tube, is covered in villi. Villi are small, like microscopically small, finger-like projections that line the inside of the wall of the small intestine. And what these are going to do are increase the surface area of the small intestine, and increasing surface area means that there's more room for the nutrients to actually absorb through. And these structures, the villi, are very rich in blood vessels. So without getting into too much detail, you can think of it like this. By nature of being small enough, those amino acids and very simple sugars can move through these very, very thin membranes on the villi from your intestines into the bloodstream. And this is how really everything you eat gets absorbed, be it food, drugs, water. It all kind of follows this similar process. And speaking of water, that is going to be the main function of the next part of our GI tract. So after the small intestine, we reach the colon, or the large intestine. And the main function of the large intestine is going to be reabsorbing water. So this food goop that we're absorbing at this point is still pretty liquidy in the small intestine, but we want that water. Water is very important to us. So the large intestine serves to absorb a lot of that water and electrolytes, and it condenses it into stool so that it can be excreted. And after the large intestine, I think we all know what happens from there. We don't have to go into too much detail, but this is really the big picture view of anatomy. This is the general stuff, and I think it covers a lot of the main stuff that you all need to know. The GI system is incredibly, incredibly complex, and this is really just scratching the surface, but I think it gives you a good idea of what's going on. And one of the other ways that the GI system is complicated is going to be our next discussion here, the microbiome. Many of you will have heard of this, and this is the community, if you will, of good bacteria that live inside of you. So most of the time, whenever we think of microbes like bacteria, we don't think pleasant things. We think diseases, or getting the cold, or strep throat, or sepsis, or a host of other infections, things that aren't really pleasant. But many, many, many bacteria are extremely beneficial for us. And in fact, there are microbes really on every part of your body. Some of them are pretty benign, like on your skin. Those just hang out there, but your skin protects you against those. But skin and your face, inside of your nose, mouth, and altogether, just inside of your whole body, or on the outside and on the inside of your body, you have around 35,000 species of bacteria. So you're covered in bacteria, is what I'm trying to say here. And they're everywhere from your gut to your skin to your mouth. But not to worry, these guys are either harmless because they can't get inside of you via your skin, or if they do, we kill them with the stomach acid, or they are extremely, extremely beneficial. And if they're disrupted, they can be linked to things like diabetes, certain kinds of cancer, or certain bowel diseases. Plus, if you've ever taken antibiotics, you'll know how important they are, because antibiotics kill the bad bacteria. Say if you have strep throat, will kill the strep throat bacteria, but it'll also end up killing a lot of the bacteria in your gut, which can cause some pretty uncomfortable gastrointestinal problems while you're on them. So we have a lot of bacteria in our gut. Very, very cool. But what do they do? Broadly speaking, the gut microbiome is vital for human health as a whole. And firstly, some of these bacteria can break down carbs. Remember how earlier I said we had enzymes that help us with this? So we do have enzymes that we produce ourselves, but some of these carbs can also be broken down by bacteria. And this is good for both of us. The bacteria break down the carbs, and they're able to eat some of them and survive themselves. And then we're also able to use some of them and get some more energy out of it. And they can also assist in the breakdown of fats and proteins in a very similar way. Besides breaking stuff down, they can also build things up. For instance, some bacteria help with the creations of certain vitamins in the gut, specifically vitamins K and some of the B vitamins. And a very surprising function that I found of the gut microbiome is that it helps maintain the structure of the GI tract. So let me explain. Even more than this, it helps maintain a barrier between itself and the body. In other words, you have barriers in your intestines so the bacteria can't get into your bloodstream, which makes sense. Your blood is supposed to be sterile and have no bacteria in it. And the bacteria actually help maintain this barrier, this structure of your GI tract. And in other words, they're keeping themselves out of your blood, which is good for us and kind of cool that they just do that. And I think from an evolutionary perspective, this makes sense because if they want to live inside of us, they can't get into our blood. So it's beneficial for them to make it so that they can't get into our blood, if that makes sense. And that's pretty sophisticated, if you ask me. And it's really cool because the microbiome and you and I and really all of us live in this beautiful commensal relationship. We help them, they help us, and everyone wins, really. And it's in both of our best interests to keep this going since it's so beneficial for both of us. And the microbiome is rather important, and there are a few things to note in regards to making sure it's healthy. You want to keep yourself healthy, but you also want to keep those little buggers inside of you healthy too. Diet, unsurprisingly, plays a large role here. What you eat affects your health, but it's also going to affect the health of the bacteria inside of your gut. Diets high in fiber, vegetables, fruit, these are all associated with a healthy gut microbiome. And many things can tip the balance as well. Radical diet changes, what region of the world you're living in, even the season of the year that it is can affect the gut microbiome. And it's a really balanced ecosystem in there, and it's really important to keep it balanced like it is. It's important to have a very high diversity of bacteria. You don't want just one or two species. You want a lot of species because in that way they'll be able to do more things. And if you just have one or two, they can kind of take over and defeat the whole purpose. And in the same vein as the gut microbiome, I'm sure many of you will have heard of prebiotics, probiotics, symbiotics. What are these things? So probiotics are going to be live cultures of bacteria, particularly the lactobacillus and bifidobacterium geni, that have been shown to improve barrier function and immunomodulatory function. So I know that's a mouthful, but remember earlier how we mentioned the barrier between the gut and the bacteria, so they can't get in the bloodstream. It can help with that. And then it can also help with your immune system, as well as break down certain things that maybe some of us aren't as good at breaking down. And these probiotics, or live bacteria, are going to be things that you ingest. So in things like supplements or yogurts or really any fermented foods is where you're going to get these from. Prebiotics, on the other hand, are compounds that you can't digest. So they're things that you can't break down and use for energy, but they are things that bacteria can. So in other words, prebiotics are almost like eating food for the bacteria. So you're ingesting things that the bacteria can eat, but not you, which helps them grow better and helps them thrive, which is all very well and good. And again, like the anatomy, this is a 30,000-foot view of the gut microbiome. It has a lot of entangled functions and a lot of benefits, and there's a lot you can do to keep it healthy. But this is the general 30,000-foot view. And next, what we're going to talk about is the enteric nervous system. So the enteric nervous system is something that some of you may have heard of, but might not be too sure of what it is. And before I talk about that, I'm going to quickly bring up the autonomic nervous system. We've talked about this very, very much on this show, and for good reason. The autonomic nervous system literally controls everything in the body that you can't, which is a lot of stuff. And we have the two branches of it, if y'all remember. We have parasympathetic, which is the rest and digest system, and then we have the sympathetic, which is the fight or flight system. As the names suggest, they pretty much do exactly what it sounds like. However, these systems are only part of the puzzle in the gut. They certainly affect the gut, but the gut has its own autonomic nervous system, if you will, a system that automatically controls itself. And this is going to be the enteric nervous system. It's an intricate meshwork of nerves and nerve bundles and cells, nervous cells, that are all intertwined inside of your gut. And it's really, really big. It has more nerve cells than even the spinal cord, the neurons. It has more neurons than the spinal cord. And this system, called the enteric nervous system, is responsible for controlling the gut. And it's really cool because it has some pretty sophisticated things that it can do. It can, in real time, detect how much stretch there is in your gut, which tells it how much food there is. It can detect chemical signals, so what kinds of foods are being absorbed and how much. And it can process this information and feed back in on itself. So if you just ate a big meal, for instance, and it feels it stretching, it feels your stomach stretching, it feels your intestines stretching, and it also feels nutrients being absorbed, or detects them, rather, it's going to say, hey, this is time to stop eating. Let's start sending some signals here to tell you to stop eating food and to start digesting this and releasing the digestive juices and increasing blood flow. And it does all of this without any input from the brain. So it's its own contained system, which is very, very cool. It's why it's called your second brain a lot of the times. And there's even more to it than that. So like I said, it can function independently from the rest of the nervous system, but this has a lot of really interesting implications because although it can function independently from your brain and the rest of your nervous system, it is still very, very, very intertwined with it. So there's still a lot of talking to each other, to use some words. They're not actually talking, but signaling, communicating chemically with each other that's going on. And this has some important implications. So for instance, someone with GI issues like IBS, they can often experience symptoms of anxiety and depression and stress because their enteric nervous system, their second brain in their gut, is signaling to the brain that something is going wrong, and that in turn increases symptoms of depression and anxiety. So they're very, very, very intertwined. And in recent years, it's starting to show that these sort of mood changes and intertwinements are not necessarily coming from the brain to the gut, or not that they're conscious things where you have a stomach ache and you feel bad. Obviously, that's pretty clear. But it's that the enteric nervous system is communicating directly with the brain and almost telling what the brain to do and how to make you feel, which is kind of crazy, and I think is an excellent point to highlight because it just goes to show how important this system is and how important and vital it is for you to keep it healthy, even for things like mood, which you wouldn't necessarily think are correlated. So that really covers the broad strokes of the heavy science that we're going to talk about today. And understanding the pancreas or liver or small intestine or food absorption on a chemical level, all of these things could take a whole episode or a whole semester-long class in university. But again, I want to give the broad strokes here because I just want to give you the background so that you can better understand the things that are going to be useful for you, the protocols, the mindset shifts, and that sort of thing. Because I think knowledge is power. And if you understand how your body works just a little bit better, then that gives you the power to actually implement the changes into your life. So all that said, let's kind of get into the brass tacks here, the GI diseases, as well as good gut health habits. So for GI diseases, I'm going to start this section by discussing some of the more common diseases and chronic conditions that people have, as well as some of the ways that they are treated. And there's two groups of GI diseases. We have functional and structural. Functional diseases are rather common and accompany other illnesses. And diseases might sound a little bit strong for some of these. You could maybe think of them as disorders, if you like. And this is going to include things like constipation, diarrhea, tummy ache, that sort of thing. Constipation, though often not as thought of as a disease, can still be unpleasant and lead to more serious issues. And treatment for these functional diseases or disorders is going to be pretty straightforward. It's going to be mainly dietary changes, so increasing fiber, eating more fruits and vegetables, or taking fiber supplements, drinking a lot of water, or even over-the-counter laxatives, if that's something that you tolerate well. And naturally, if you try all of these, it is going to be best to check with your doctor, and that's a big caveat. I'm just going to make this caveat once here. All of the conditions I'm talking about today, I'm going to give general symptoms and general treatments for them, but it's always going to be best to check with your doctor so that they can actually understand your situation personally and what's going on specifically and uniquely with you. And the second category are structural diseases, and these are a bit more serious. These might not be fixable with lifestyle changes alone and can include things like inflammatory bowel disease, colon polyps, or even colon cancer. So now that we've kind of talked about the broad categories, let's get into the common diseases. So the first one is IBS, or irritable bowel syndrome. And as the name suggests, it is a chronic disease in which your bowels, specifically the stomach and intestines, are irritable. And this can present with stomach pain, cramping, bloating, and changes in your stool and how it's passed. And alas, IBS is a bit of a broad disease, so unfortunately the exact causes aren't well known. But there are a good amount of things that we can do to manage symptoms. And unsurprisingly, again, diet is going to be big here. Avoiding foods that trigger your IBS could be very helpful. And this is going to be something individual to you, and you're going to have to figure out via trial and error. There's also a bunch of medications that are given for IBS, and most of them are going to be treating the symptoms like the pain or the bloating. But there are a few meant specifically for IBS. Next up is celiac disease. Celiac disease is effectively an allergy to gluten. So gluten is going to be found in a whole bunch of foods, breads, grains, flour, that sort of thing. And it is an autoimmune disorder. So what that means is that your immune system sees the gluten and it overreacts to it and thinks that it is bad or an invader. Your immune system protects you against foreign invaders and pathogens. So if it attacks something that it shouldn't be attacking, like gluten, and eating gluten, then it's considered autoimmune. And what happens here is that when you eat gluten and you have celiac, it's going to enter the intestines, and it slowly damages the villi that we talked about earlier in the intestines, which can really, really hurt how well food is absorbed, which can have a host of symptoms. And this damage can cause things like diarrhea, fatigue, weight loss, gas, and nausea, just to name a few. And worse than that, there are some uncommon, or I shouldn't say uncommon, but there's some symptoms that seem a little different than the normal GI symptoms that people experience. So over half of adults who have celiac disease have these non-GI related symptoms, and some of them are going to be like anemia, loss of bone density, skin rash, mouth ulcers, headaches, numbness and tingling, joint pain, and elevated liver enzymes. The key here is that if you're having strange symptoms, especially GI symptoms associated with something like fatigue or low iron, then it's probably going to be best to get it checked out, and it might be a good idea to take gluten out of your diet and see if that improves it at all. And we can also test for celiac disease with some blood tests as well as endoscopies. Endoscopies are going to be where they go in with a camera and look at your GI system. And unfortunately, really the only treatment for celiac disease is not eating gluten whatsoever. But thankfully, there are more and more gluten-free options becoming available nowadays. Next up, we have GERD, or gastroesophageal reflux disease, and this is when you have frequent acid reflux, which in a word is when the acid in your stomach that we talked about earlier travels up your esophagus and into your mouth or throat. And it often presents with heartburn or that feeling of burning in your chest, trouble swallowing, the feeling of a lump in your throat, and of course the acid reflux if it does come up all of the way. And again, here we can confirm this with a endoscopy where they look at your esophagus and stomach by going in through your mouth with that camera. And as far as treatment goes, there's a lot of over-the-counter antacids, think Tums sort of thing, that can help treat the symptoms, and there are some prescription strength medications as well. Next up, we have Crohn's disease, and Crohn's disease is the inflammation of the GI tract generally. Most commonly, it's going to be in the small and large intestines, and it can cause a lot of symptoms to appear, a lot of the similar GI symptoms that we've talked about. So fever, fatigue, belly pain, bloody stool, kidney stones, anemia, diarrhea, and many, many others. And the more serious symptoms like blood in stool or belly pain or prolonged diarrhea for something like 2 weeks is going to really warrant a doctor's visit here. And the reason for this is Crohn's disease can have a lot of really nasty complications, like some colon cancers can be associated with Crohn's disease, ulcers, blood clots, or even bowel obstruction. So it's important to take it very seriously. And like with some of the other diseases, there are blood tests and procedures, like having a colonoscopy where they go up the other end with a camera and look at your colon. And that can help the doctor come to a more complete diagnosis and be sure of what's going on. Unfortunately, there is no cure for Crohn's, but there are some drugs that help with the symptoms. Some of these are going to be anti-inflammatory meds, immune system suppressors, antidiarrheals, pain relievers, just to name a few. And nutrition also plays a big role here. Eating a diet that doesn't make your symptoms worse is obviously going to help. So high in fiber, fruits, vegetables, yada, yada, yada. And some therapies have even been tried where you get nutrients delivered through an IV to help reduce some of the symptoms. So next we have diverticulitis. Diverticulitis involves what we call diverticula. These are bulging pouches on the walls of your colon. Many adults have them, but the issue arises when they become inflamed. So little lesson for you here in medical terminology. If something ends in itis at the end, that means inflammation. So diverticulitis is inflammation of the diverticula, or pancreatitis would be inflammation of the pancreas, and so on and so forth with all of the itises. And diverticulitis normally comes with nausea, fever, tenderness in the abdomen, changes in stool. Certain blood, urine, and stool tests can be done, as well as a CT scan to confirm. And as far as treatment, a liquid diet, foods high in fiber, and rest is generally recommended. But it can be bad enough to where you need surgery, and this surgery could be as simple as going in and draining one of these diverticula, or it could be as serious as getting a colostomy bag put in or having part of your colon removed. And finally, we have gastroparesis. Gastroparesis is something that my mom has, actually, so I know a decent amount about it, and it's a pretty nasty thing. It makes you feel like you have the stomach flu. My mom said that she felt like she had the stomach flu for years and years and years on end before she had this properly diagnosed. And what it is when your stomach cannot empty properly. So remember earlier how we discussed how the stomach actually mechanically moves food along with muscles. So gastroparesis is when your stomach doesn't do this, which can cause the stomach to just have food sit in there, which can cause a bunch of nasty things to go on. So vomiting after eating food, feeling very full very quickly after eating food are a couple of the symptoms. And the exact cause isn't known, but there are certain risk factors like diabetes, infections, certain kinds of cancers, hypothyroidism, or having had previous GI surgery. And the diagnosis can be done with an upper endoscopy, so again, going through the mouth with the camera, as well as ultrasound or scintigraphy. This is where you eat a light meal with some radioactive material in there, and then they can track the radioactive material as it moves through your body and see how long it takes for your stomach to empty. And the main treatments here are going to be diet and how you eat. And a couple of the recommendations are chewing food very thoroughly, not swallowing it very quickly, eating a bunch of small meals during the day as opposed to a couple of big ones, low-fat foods, soft foods, not drinking fizzy drinks or alcohol, and avoiding foods that are like super, super high in fiber. You're going to want some fiber still, obviously, but foods that are really, really high in fiber can harden in the stomach and form what is called a bezoar, and this isn't good news. And there is also one medication out that treats gastroparesis specifically called Reglan. But now that we've covered a lot of the common GI diseases, let's talk about some of the more general advice for people who either don't have these diseases or have diseases that can be treated and managed with diet. So, unsurprisingly, a lot of the advice here for good GI health is going to come back to diet. And thankfully, a good diet for good gut health is merely a good diet. So it's not like you need to have a completely different diet to make your gut healthy as opposed to just being healthy. I talked with a dietitian a couple weeks back, Parker Nelson, and I have an episode up where you can look at our conversation, and he gives a lot of really, really good, actionable advice for dietary tips and changing your diet. So be sure to check that out. But let's get into some of the broad points so that we can cover that in today's episode. So a couple general rules of thumb that I've already laid out a little bit here are going to be water and fiber. So one of the biggest things in your GI tract that's important is having the food move along at a good pace. And if you don't drink enough water and you don't eat enough fiber, this is going to be really difficult. It's going to be difficult for your body to move the food along, and this can cause constipation and other problems and put a lot of stress on your GI tract. And there are two kinds of fiber. We have soluble and insoluble, and the names are referring to whether or not they're soluble in water. So soluble is, insoluble isn't, and this means that the soluble can dissolve in water and the insoluble can't. And soluble fibers are really good. They can help lower cholesterol and blood sugar, and these are going to be found in oats, peas, fruits, and beans. And insoluble fiber can help with constipation, and it's going to be found in flour, nuts, beans, and vegetables. Both of them are important, and as a general rule, around 30 grams of fiber per day is recommended. So load up on those fruits and vegetables and beans, and maybe even take some fiber supplements if you would like. And beyond that, standard diet kind of advice: lean meats, vegetables, fruits, rice, healthy oils, think avocado oil and olive oil instead of seed oils or animal fat, are going to be pretty cornerstone for a good diet. Limiting processed foods and fast foods is also a pretty ubiquitous piece of advice as well. We'll touch on that just a little bit more in a moment, but measuring out how much food you're eating and seeing what a serving size actually is helps. Eating on a consistent schedule, and even taking longer to eat a meal so that you feel full at a proper time, as opposed to shoving a bunch of food down and then finding out you ate too much. And as I said earlier, giving your microbiome a boost with prebiotics and probiotics can be helpful. So incorporating fermented foods like yogurt, kimchi, sauerkraut, as well as supplements can really help boost your little bugs out as well. And naturally, when talking about diet, it's really always important to note that everyone is different, and we all have a pretty wide range of variation between us. So above and beyond everything I just said, I think it's important to experiment with your diet. Find foods that work well for you. Find foods that make you feel healthy, that make you feel good. And, start with the basics. Start with the lean meat, fruits, vegetables, and down the line. But find what fruits do you like? What vegetables do you like? How do you like your meat cooked? Do you like certain kinds of meat over other kinds of meat? These sort of things to kind of narrow down how you want to eat and what you want your diet to look like. And I think another thing is making sure that you have foods that you actually enjoy eating, because if you wanted to, you could eat chicken breast, rice, and broccoli for every meal of the day, and presumably that would be reasonably healthy, but you'd get sick of it after a week and quit and go back to eating unhealthy food. So it's important to find a sustainable diet for you that you actually like and that's actually good for you. And another thing I want to bring up here in terms of mindset or frame shift is talking about how stringent you want to be with your diet. A lot of times diet fads are super, super hardcore. You need to be on this diet with these macros every single day, and if you fall off the wagon, you're a failure. That's just not realistic or sustainable again. So it's really important to have a little bit of grace for yourself in this regard. And I heard an idea about this, or an idea that applies to this recently, called forming daily-ish habits. And this is opposed to forming daily habits, because if you form a daily habit, then you have to hit it every single day. And if you don't, it's going to weigh down on you and you might think like you failed. But if it's daily-ish, that's plenty. You don't need to eat a perfect diet every single day. But if you eat a perfect diet daily-ish, then that's pretty good. And then in that plan as well, you can have days where, you go out with friends and have a nice dinner out, and maybe you don't eat as healthily as you would like, but that's just one day. And another story here that I think kind of sums it up really nicely is Arnold Schwarzenegger, the famous bodybuilder, the guy who really pioneered bodybuilding and was an actor and governor of California. That Arnold Schwarzenegger, in case you don't know who I'm talking about here, he said, in terms of bodybuilding and diet, that you could eat whatever you wanted on the weekends, eat literally whatever you wanted, however you wanted, as long as during the week you were super strict with your diet and you stuck to it to a T. And this gets a similar idea of across, where daily-ish habits, you don't have to hit it every single day always. There can be a couple days where you're off, but as long as the majority of the time you're hitting the mark, you're going to be good. And besides diet, there are a couple of other things to mention with gut health. And the first big one is stress. Stress can negatively impact your microbiome in a couple of ways. and this can have very negative impacts on your gut. Firstly, stress can send signals to the gut that can radically change the composition of the microbiome, which can cause good bacteria to die and less good bacteria to thrive. And you want the good bacteria to thrive, not the bacteria that isn't super beneficial for you. And there is even some evidence as well that in people who are stressed, pro-inflammatory bacteria thrive more. So what this means is that if you're stressed, then the bacteria in your gut that thrive are the ones that cause inflammation, which isn't going to be very good for your health. And then it forms this nasty feedback loop where you're stressed and then you feel worse because your gut is talking to your brain, making you more stressed, and then you don't feel good in your gut, which makes you even more stressed. So managing stress is really important. I have a whole episode on that. And a couple more things with stress here. Chronic stress can also lead to what is called leaky gut. And this is where the bacteria seep from your intestines and your GI tract into your bloodstream. Remember how earlier we said you don't want this to happen. You don't want any bacteria in your blood. If you're chronically stressed, though, it can actually cause some bacteria to leak into your bloodstream, which can cause inflammation, which isn't good. And then finally, this one is more of a behavioral thing. Stress and depression can cause you to eat more hyperpalatable foods, fast foods, eating foods that aren't particularly good for you but are really tasty. These two things are associated reasonably well. And if you eat hyperpalatable foods, I mentioned that I would talk about this earlier, you're feeding your bacteria things that aren't particularly good. So the bacteria that are going to thrive are the ones that thrive on hyperpalatable, hyperprocessed foods. And those aren't the bacteria you want. You want to feed the bacteria really healthy foods because what's going to make you feel healthy is going to have bacteria that are eating healthy foods. So let me put it this way. It's like natural selection. So if you only have hyperpalatable, hyperprocessed foods, the bacteria that form that are naturally selected are going to be the ones that eat those. And if you eat really healthy foods like fruits, vegetables, and so on, then the bacteria that are selected for, really by evolution, if you think about it, are going to be the ones that feed on those. And those are the good ones, and the hyperpalatable bacteria are the bad ones. So you really want to focus on diet really a lot here in the microbiome. The interplay between them is really, really important. And two more. And the first one is exercise. So exercise is really important for your gut health. And a lot of times there's a lot of cardiovascular, heart, lungs, that sort of stuff going on. But it's a little bit more simple with your GI tract. So put simply, it can help improve how your GI tract moves food. If you're moving more, then your GI tract is going to move food through more. And this can help with constipation and can help things moving down there, which again is very, very good. And being physically active also causes your GI tract to have more blood flow to it, which means more nutrients are getting absorbed and it's just getting more blood flow, which is a good thing in general. And I talk about exercise practically every episode, and I don't want to harp on it too much. And I have a whole episode on that, so if you want to learn more about exercise, please do check that out. And finally, we have sleep. As with all my episodes, we have the trifecta, the holy trinity of good health, if you will, and that's going to be sleep, exercise, and diet. And sleep is the last rung on this, and sleep improves everything. It improves every facet of health pretty much. It improves mood, it improves mental health, and gut health is no different. And good sleep can impact the bacteria in your gut, helping more good bacteria to be there. It keeps hormones balanced, and it can even help with some disorders like GERD or inflammation in your intestines. So, gut health and GI disorders might not be the most thrilling or exciting topic. I totally get it. But they are really, really important. After all, the machinery that turns your food into fuel, well, is going to affect you because that food does turn into you. So you want this to be a pretty well-oiled machine. And the process has effects that are global. It has effects that are all over your body. It affects really everything from mental health to diseases to stress. There's really a lot of good reasons to care about your gut health. Furthermore, gut diseases are relatively common, and knowing how to manage them can help dramatically. So taking maybe some of the diet tips or sleep or exercise or these sort of things, even some of the mindset shifts like the daily-ish habits, can really improve your gut health in this way. or even just knowing some of the common warning signs, like when to go to the doctor, having blood in stool, or having unusual bowel movements for a prolonged period of time, or having a bellyache. All of these things are things to go check out with your doctor, and not things to just let go by the wayside, because that can have really long-term bad effects for you. Eating well, sleep, exercise, reducing stress. These are all things that I've talked about ad nauseum. I have episodes for almost all of them except sleep, but I should get an episode on sleep since I talk about it so much. And really, they're the cornerstones of health, and improving them will not only lead to better gut health, but just lead to better health as a whole. And much of preserving gut health is preserving the health of the microbiome. So feeding yourself and the bacteria good food is important. Feeding the bacteria prebiotics or taking probiotics can help with this as well. And these little guys are really doing a lot of the heavy lifting. They're going to affect your mental health. It's going to affect your sense of well-being and all kinds of other stuff that we've talked about today. So when you eat, don't just think about what you're feeding yourself, but also what you're feeding your friendly bacteria. Gut health, guys, it's so important. And if you stayed this long, I appreciate that a lot. And thank you so much for listening. And most of the people who watch this aren't actually subscribed. So if you all could do me a big favor and just hit that subscribe button, that would help out tremendously, and share it with friends and family if you liked it, or if they think they might have something to learn. But without further ado, I hope you guys have a good day. I hope you learned something, and I hope you all have some better gut health going forward. Peace.